Hi there. I'm here today with Gouri Pimputkar, who is a board certified obstetrician and gynecologist who focuses on chronic hormonal conditions in women. And she's here today to talk to me about the perimenopausal period and different things that you can do when you're in this period. So, hi, and thank you so much for being here today with me.
Hi, thank you for having me. So glad to be here.
Yeah. So I think, most women know that menopause is when you don't have a period, and it is defined as when you haven't had a period in over a year. But most of us are not aware of the perimenopausal period, right? Which is the time leading up to that, which can be, 10 years or more, where your hormones are changing in ways that you may not necessarily recognize and impacting your body. So when you see women in perimenopause, what kind of symptoms are they coming to you with?
Such a great question. As you mentioned, the perimenopausal period can be sometimes up to 10 years before women lose their periods. And the average age in the United States is about 50 to 51. So, for so long, I think women suffer in silence. They think these are natural, normal symptoms that they just have to deal with. But there are so many options to help manage those symptoms ahead of time. And the most common symptoms that we see are patients experiencing, obviously, the hot flashes and the night sweats that you hear people talking about, but also there's brain fog, and there is change in just energy levels, and also there's symptoms of lack of energy, as well as vaginal dryness can start happening. And then the most common symptom is irregular periods. And irregular is just different than what your normal pattern was prior to that time. So the best way I like to describe it is, a lot of these changes are happening because of what's going on with our ovaries. Our ovaries are starting to change in terms of the amount of hormones that they are producing. And it's not an on and off switch, it's like a dimmer switch. So there are going to be moments in time that are going to be, your symptoms are going to be more pronounced, and there are going to be times where they're going to be not as intrusive. And so, with that being said, there's so many other factors that kind of control that switch, that dimmer dial, and that's where I think the conversation about premenopause, perimenopause, and what we can do to help with patients at that time makes such a difference.
Yeah. And I think some of those symptoms, everyone associates hot flashes with hormonal changes and changes in your period. But I think when you're talking about symptoms like brain fog and, fatigue and energy, those are things that we blame on everything else, right? I'm not trying hard enough. I'm working too hard. I'm not sleeping well enough. My kids are stressing me out, right? I mean, frequently women who are perimenopausal have teenagers. So there's a lot of things competing for your time. And I think it's really easy to blame these symptoms on other things and not recognize that they're hormonal. And I think it's a hard time right now, right? Because it used to be that everybody had a gynecologist that they saw every year because we did PAPs annually, but we've changed those recommendations. And so a lot of women don't have a gynecologist or don't see them quite as regularly. And so maybe they're not talking about some of these things. So when do you think a woman should seek help?
So, honestly, that is such a great point about the fact that we are busy women and we have life that's happening. And and I say collectively, we, because I put myself in the same category,
Absolutely.
we save all of our concerns, questions, and problems for our 15-minute annual exam if we make it to that exam. And I wish I could stress how important it is first to prioritize ourselves and to really listen to what our body is saying. And yes, sometimes it is the extraneous factors of life, work, kids, stress, all the other things that can be contributing to the symptoms that we're having. But we also know deep down when we think something is just feeling off. And so when you feel that, when you hear that, I think it's important to keep track of what the symptoms are, see if there's any correlation in association with our menstrual cycles. Because as ovulating women having regular menstrual cycles, there are definitely times or seasons where symptoms can be more prominent or can be a little bit more subdued. So I think keeping track of that in between your appointments and your visits is important. And then the bottom line is if it's interfering with your day to day and you don't feel like you are showing up for what you need to as your best self, I think that's the time to initiate the conversation with a provider. So it could be sometimes I have patients that will come to me literally 1 month or 2 months after their annual exam, and they're like, I was feeling great, and then I'm not. And I'm like, I'm so glad you came to see me. I'm so glad that you took the time out and prioritized yourself so that we can start this conversation of where you are right now, what's going on, and how we can help you navigate these changes.
So when someone comes to see you, because I just want to drill down a little bit on keeping track of your symptoms. In your dream world, what information do they come to you with, right? To make this a little bit easier in terms of diagnosis and treatment.
So I would love to have patients keep track of, if we're talking specifically of menstrual
Yep.
cycles, let's start with that. I would love to know how often they're happening. I would love to know how long a woman would bleed for when they have it, if it's um, if there's any other ancillary symptoms associated with it. For example, if there's spotting before it or if there's spotting afterwards, how heavy the periods are. And, I don't need direct quantification, but just in general, like, hey, I'm noticing I'm going through my supplies a little bit more often than I did, say, compared to 2 years ago. And then if there's any symptoms of pain, either beforehand or afterwards, and that's just the nature of the period. And then the other symptoms that I love to know about is how are you feeling like a week before, 2 weeks before? Do you notice that your energy levels are changing? Are you noticing more emotional changes? Are you noticing that your fuse is shorter with your family, your children, your work? You feel like you're more irritable? Are you sleeping more? What is your nutrition like during the leading up to the period as well as immediately afterward? So in my perfect world, I would love to know about nutritional habits around the cycle. I would love to know about sleep patterns, your mental state during that time. Um, Also like bowel and bladder habits during that time. I think they all play such a significant role during this during our menstrual cycles.
Yeah. So having someone come in with, a monthly calendar, right? And writing all of those things down with respect to your period would be helpful.
Absolutely,
Yeah.
absolutely.
And I always encourage people to write things down too, because, if you asked me what I had for breakfast yesterday, it's pretty unlikely that I would remember, right? I mean, and so if we're not writing it down, then we're just kind of guessing. I mean, we're so busy. And sometimes there are small changes that you're not necessarily paying attention to, right? You may not realize when you're becoming more emotional, tired, brain fog with respect to your cycle, right? So writing it down is so important. What about checking hormone levels? When do you think that's important?
Um, so honestly, it's
I
such
love
a
your
trick
deep
question.
sigh.
Yes, it's such a trick question.
It's
So,
not a trick question. I mean, I think I probably have the same answer you do, but people come in and ask me all the time and they say, I want a hormone panel.
right, absolutely. So I do believe there is a time and place to check hormones. It depends on what we're talking about. So with in the context of periods and irregular periods, yes, if we're talking about the premenopausal menopausal transition, by definition it's no or no periods for a full year. And there are patients who get really close to that full year mark and they're curious as to where they are. So it's not inappropriate for peace of mind for checking some levels, specifically like precursors to hormones that create estrogen, progesterone, things of that nature. So we call them the FSH levels. And that's not, that would be an appropriate use of testing hormones. But the reality is that our hormone levels change on a day-to-day basis. So that one snapshot, one evaluation on that particular day literally will look different for most women the very next day. So I don't routinely check hormone levels unless there are symptoms that are indicating that we need to look at them. And on the other end of the spectrum, for irregular periods, more in the reproductive age group, for example, with chronic hormonal conditions like polycystic ovarian syndrome, there is a reason to be testing for hormone levels at that time, just because we're looking at a completely different set of symptoms.
Yeah. So then would you say that most of the time in this period, we're really treating based on symptoms versus lab values?
Absolutely, absolutely. My like always take home message is I don't want patients to feel victim to their hormones. I feel like we can become more educated as clinicians, as patients. And with that being said, if we take a step back and say, why is it so important that we need to know what a hormone level is in order to help us feel better? We just need to work with our symptoms and to kind of move forward in that direction.
Yeah. Yeah, I definitely agree with that. So then in the perimenopausal, do you treat women with hormones?
Absolutely. There is a time and place. There's different ways to deliver the medications. It all depends on what the goals of the patient are, what symptoms are the most, um, bothersome, or the symptoms that are really interfering with their day-to-day activities. Sometimes it's simply the periods becoming irregular during the perimenopausal time. And so patients would prefer to have management of their symptoms, and we can help with that with hormonal preparations. Sometimes it is the vasomotor symptoms or the hot flashes and the night sweats. Sometimes it's all the other ancillary symptoms of mood changes and energy levels. So there's different ways to address the symptoms of patients in the perimenopausal period. I don't believe there's a one size fits all magic medication that's going to save the world.
Yeah, no, it's true. It definitely is person by person, right? And important to individualize it. And then, one of my favorite things in the world is vaginal estrogen, just because I feel like it is so helpful for so many women. And there are just so many vaginal and bladder symptoms that women get and frequently don't realize that it's hormonally related. Do you use vaginal estrogen? What are your feelings on vaginal estrogen?
Absolutely. I think it is such a great medication that can give so many different treatment results and really help improve a patient's experience as they're going through this transition, whether it's premenopause, even for younger women who are on chronic hormonal contraception, where because of the way the medicines are working, they might be altering their natural hormonal state. There's even a place for vaginal estrogen at that time. So this is, it's a medicine with I don't want to say complete zero risk, but very minimal risk in terms of systemic absorption. And it can really help improve the tissue quality, the healthiness of the vaginal tissue, as well as, like you mentioned, improving bladder health and urinary frequency, and helping with recurrent urinary tract infections and all sorts of symptoms that patients just don't realize that it's actually all related. And so I am a big proponent of vaginal estrogen.
I had a feeling you would be. So one of your passions is also lifestyle medicine. And so, in this perimenopausal period, hormones can be important, but what other lifestyle factors do you think impact women?
This is such a great question. So, to backtrack a little bit about my how I became involved in lifestyle medicine, I've been board certified obstetrician and gynecologist practicing for close to 18, 19 years in the traditional clinical setting. And I noticed as I was aging with my patients and aging with my practice that the thing that I was missing for my own professional fulfillment was that I didn't feel like I could connect with my patients and really help undo some of the things that was getting patients to a place where they were feeling like they were falling apart and that they were becoming, like I mentioned earlier, like victim to their hormones and their symptoms of the perimenopausal and menopausal transition. So I started just, doing some research on my own and incorporating, I call it common sense medicine, but I started incorporating just little pearls like, hey, like, let's talk about, I know it doesn't seem like it's related, but maybe the lack of sleep and the emotional stress eating that's happening at nighttime because you're worried about, XYZ problems going on in your life. Like, I think it's all related to your weight changes, which is affecting your periods, which is affecting your hot flashes, and everything seemed to be connected. So with that being said, I noticed that I was just inherently incorporating some of these pearls into my practice. And then through, kind of just serendipity, I listened to a few podcasts. I started reading some more information, and there's a whole field of medicine called lifestyle medicine, and I became board certified in it. And now I am just super passionate about practicing it. So, with that being said, I think the components of lifestyle medicine are really paying attention to nutrition. There's not one diet that will help change all the metabolic symptoms that happen during the perimenopausal transition. There's no eat low carb or keto or whatever the diet du jour is. There's nothing that is going to change our inherent tendency to having weight changes as we start going through the perimenopausal transition. So I pull it back a notch and say, all right, let's talk about like what is a healthy way of eating that can really support you. So I recommend whole food, plant-based diets primarily, but obviously what's sustainable for where patients are and where they are in their life. We talk about really prioritizing sleep and restorative sleep and making sure that we are addressing the changes that can happen if our sleep patterns become wonky, for lack of a better way to explain it. And then also talking about decreasing substances that are not helpful for us, like decreasing excessive alcohol use and things of that nature, and improving our connections with social connections, especially with the pandemic that really highlighted the need and the importance to keep our mental state in a proper place, as well as improving our exercise. And exercise not to, burn calories and lose weight, but exercise in a mindful way so that we can really start feeling better about our bodies. With that, and how that ties into perimenopause, is all of these little tweaks and changes can make that transition as our hormones are starting to change naturally. They are going to be declining, as they're supposed to as we approach the menopausal transition. I think these changes can help ease that transition.
Um, it's funny, right? Because what you're saying is common sense medicine, but I think it's common sense that fails many of us, right? It's very easy to see these things in someone else. It's not always easy to see them in yourself and what you are doing. Is there one area that you think is more important than another area when someone comes to you in kind of the perimenopausal period? I mean, if I said to you, I hear what you're saying, I cannot do all of that right now, where should I start?
I love that question. So I think, and again, I'm speaking generally to patients that identify as women. I believe the number one place that we can start is with stress and sleep and self-care and really prioritizing us, because most women are we're stretched too thin and being run in multiple directions and very rarely prioritizing our own health. So I think, yes, it's easy for me to say, okay, you need to decrease your stress. But the idea would be like, okay, let's dive deeper. Let's talk about the 5 things right now that are really, really taxing your mental energy. How can we change or eliminate or even just lessen some of that mental stress? How can we incorporate 5 minutes a day of doing something for yourself that might help you feel like you can start changing how you're showing up in the world? And all of these changes, believe it or not, impact our stress hormone levels, and they impact the quality of our sleep when we do get to finally go to sleep. And so all of these little changes, I do believe, is what can help women go through this transition.
Yeah. So when you're helping someone with lifestyle medicine, how often do you see them?
So I currently work with a company called Alara Health, and it's an online collaborative care system, which is it's amazing. It works with patients all over the country, and it's a team approach in terms of working with a provider. Typically, it's either a physician or an advanced practicing provider, and then we work with a registered dietitian as well. And so this combined approach really looks at the big picture, because as physicians, it's been very easy for me to say, okay, here are the hormonal conditions that you are, struggling with. Here are some medications that we can help, or here are some lifestyle changes that we can do. And then I'll see you back in a year. And it's not sustainable. Patients, they need guidance. I'm part of that roadmap that gives them guidance to help them. So in terms of how often, a lot of it can be dictated by what the patient's needs are, but we see them usually 4 to 6 weeks is kind of a rough average. And then they will also work with our registered dietitians who check in very frequently. They will meet with them initially and then check in on a weekly basis, which I think is also important for accountability. And just the whole idea is, collaboratively, we want to set our patients up for success. We want them to feel better with whatever hormonal chronic conditions that they're struggling with.
Yeah. What you just said really resonated with me because I too will frequently say, oh, I think if you lost a little bit of weight, controlled your stress, these things would be much better. So you go do that, right? So I've kind of given them the recommendation, but I'm not always providing the support um, to help get them there, right? And so that support becomes really important. Um, because it's hard to stay focused. It's hard to recognize what little changes you need to make, and sometimes even just recognizing that small changes are the way to go, right? I think we all want to change everything immediately.
Absolutely. And so much of this is mindset for the patients, but as well as for us as providers. We do inherently, we just want to help, and we want to help make our patients feel better. But I think having these established connections, and that's what this platform has given me the opportunity to do, is really understand where my patients are coming from, and like understanding their life experiences that brought them there, and then what they can really do and what they are not going to be able to do right away. But the small changes along the way, they're so important. And it gives us the opportunity to validate those small changes, as well as say, hey, like, look at what you've accomplished. And if you can do this, let's try the next step. So that's where the beauty lies in
Yeah,
this.
the supporting and cheerleading, right? And getting
Absolutely.
someone to where they need to be. So, if someone's having perimenopausal issues, they can definitely see their own provider, right? You can see someone in person, but there are also these new kind of online resources, which you're a part of, which can also provide support for women.
Absolutely. So I am still a strong proponent of having an in-person, annual gynecologic exam every year because it's so important to have the physical exam, even though your provider may not be doing an actual pap smear every year, but there's so many other things that need to be evaluated and can be assessed, including breast exams. And, the online space will never take the place of that. The telemedicine platform or the online platform, it really provides, like you mentioned earlier, the coach that kind of guides you along. But the beauty of what we do is we are board certified. We're practicing evidence-based medicine. We're able to prescribe medications that will help you during the journey, as well as provide the additional support with the dietitian. And so I think they're in a perfect world. I would love to have everybody be on the same team with the
Yeah.
same focus and the same goal of we just want to make our patients healthier so that we can, in the long run, prevent all the chronic diseases that come from these chronic hormonal conditions, the diabetes, the cardiovascular disease, the obesity. Like that's the ultimate goal, is to do this together. There's no prize if one person, helps somebody lose the weight or has helped somebody with the hot flashes. The goal is for all of us to do this together.
Yeah. Yeah. Um, can you see patients from all states or do you have limitations?
So personally, I'm licensed in a few states, but
Hmm.
the platform we do have currently, we have 20, 21 states up and running in terms of where we're able to see patients. And we're actively working on acquiring more states. The goal is to have Alara Health accessible in all 50 states. We do a subscription based model for patients, as well as taking insurances. So patients are surprised quite often. Insurances want to cover these types of visits because it's less work for them. so,
Yeah.
um, so there's so many opportunities for patients to get involved in this space.
And if they wanted to look for you, where would they find you online?
So patients can find me at Alara Health. It's ALLARA health.com, or they can also find me on social media at Wellness with Dr. Gouri, which is Gouri.
Okay. Do you have any parting words of wisdom for women who are in that perimenopausal period?
My biggest piece of advice is don't wait to start the conversation. And I think if it's not taboo. It's normal. It's natural. We're all going through it. And I think the more we talk about it, the more we educate ourselves from people who really understand what's happening during this time. I think we can really kind of gracefully go through this transition. And that's the ultimate goal. So my biggest piece of advice is don't wait to start the conversation. Don't wait till your annual exam. If you are not feeling your normal self, let somebody know. Look at, online for resources and find people that will actually really have the same goal as to make you feel better.
I love that. I think that's such great advice. And I think it's important to empower women to talk about it, right? Because we don't want to. And it's just a natural process. There's no shame. It's not weakness. It's just something that happens and we have to figure out how to go through it together.
Absolutely.
Yeah. So thank you so much for your time. I really appreciate all of your words of wisdom and best of luck to you.
Thank you so much. Thank you for having me.
Um, that was awesome.
Ah!
And it's so funny because I was listening